October is Breast Cancer Awareness Month, and we're joined by breast cancer survivor Barbara Eaker and world-renowned Houston plastic surgeon Dr. Mark Schusterman. Thank you both for joining us this day. Barbara, you have quite a story to tell. Let's start from the beginning of your diagnosis. What type of breast cancer and what stage were you diagnosed at?
I was very early and very lucky. It was diagnosed in a routine mammogram, which I had every year, and it's very important to have your mammogram every year.
Your doctor told you that you should perhaps consider a mastectomy, which is what you ended up doing?
Right. After consulting with my surgeon and my plastic surgeon, Dr. Schusterman, it was decided that that was the best way for me to go.
Dr. Schusterman, a woman deciding to take her breast is a very difficult thing to go through. But I just think it's incredible now that you can go in moments after her surgery and help reconstruct her so she never has to go through just the horrible pain of it all. It does help a lot, doesn't it?
It does. I think that a woman is facing two major issues, obviously, when they have breast cancer: the fear of a life-threatening disease and the fear of body image distortion or injury. And if we're able to at least alleviate one of those early on during her treatment, I think it's a huge plus for any woman having to undergo breast cancer.
What types of options are available for a woman who has to undergo a mastectomy?
There's three basic options. There's the use of an implant, there's the use of her own tissue, and then there's an option where we use a little of both. We use an implant and some of our own tissue. Without going into all the details of the various types of procedures, it's just important for each woman to have the procedure tailored to their own specific needs. Not every woman is a candidate for one procedure over another, but each woman has to be evaluated and make sure that their treatment is specifically designed for them.
In a situation like that, do you just work closely, the plastic surgeon works closely with the oncologist, and together you're just a team
Absolutely.
During the surgery?
Absolutely. Absolutely. In fact, that's the most important relationship, is to have a good relationship with the oncologic surgeon and make sure that you all are communicating and on the same page.
Barbara, do you feel like it helped you to have this option to be able to have some reconstruction before you were awakened and just all your own tissue and everything was gone?
That was utmost in my mind, and I certainly hope that people aren't frightened of having reconstruction and mastectomy, because my surgery was painless, basically. I never took anything stronger than Tylenol.
There is so much controversy lately on mammograms, when you should get them, if you should even get them. You must have a strong message to share, since yours was found routine mammogram. You had no symptoms, you hadn't found a lump or anything like that?
No, nothing. Didn't have a history of breast cancer, and all of a sudden there it was.
Well, Barbara, Dr. Schusterman, thank you for coming in and spreading this word. I think it's going to help a lot of women, perhaps not even today, but if they realize that they're going to have to go through this, that they know they have options. Great to talk to you both.
My pleasure.
Thank you.